Hello everyone. So today I'm going to discuss contraception, which is a very important topic in the OBS and gynae portion. So before going into the details, let me tell you a few quick points. So for the purpose of exam, you can categorize contraception into two broad categories. Okay. So the first one can be emergency contraception, and the second one is regular contraception. So you have a lady coming in either asking for emergency contraception or regular contraception. Okay, and um, for both patients, you will follow a different approach. All right. Now, emergency contraception, as all of us know, it has some particular regimes and different methods. I will discuss it in a separate video. But for regular contraception, you can think about three categories of contraception. Number one is barrier contraception. Number second is the pills. Okay, so the pills are either combined oral contraceptive pills or the mini pills, which are the progesterone only pills. And then there are long-term methods of contraception. So long-term methods of contraception are basically injections, okay, and implants and IUD, which are intrauterine devices. All right. So we have the barrier methods, then we have the pills. Okay. The pills can be either combined or progesterone only, and then we have the long-term methods. The long-term methods are injectables, right, and implants and the intrauterine devices. Now, out of these, almost certainly nobody will come to the GP asking for about the barrier methods of contraception. Okay, and the long-term methods of contraception, they are not as common. So the commonest out of all these is combined oral contraceptive pill, which I'm going to discuss today in this video. Okay, so we'll be discussing the data gathering portion, and then what to examine, and then how to provide management to this particular patient. Okay, so for example, you have a lady coming in and she says, doctor, I want to start the pill. Okay, so how will you go about doing data gathering investigation? So first of all, as we do with all the cases, we ask open-ended questions. Okay, so we will ask the lady, if you can please tell me a bit more about it, okay? And if you want to start the pill, is it for the purpose of contraception or is it for some other reason? Because there are other reasons for starting combined oral contraceptive pills as well, because some of the ladies who have irregular periods or painful periods, they might also want to I might also they have done some research or have heard from their friends and might want to start the COCPs. Okay. So once you establish whether it is for the purpose of contraception or not, then you will proceed further in the station. Okay. So then you will, so basically this question that we are asking here, it's also a part of the ideas, concerns and expectations, but it's important that we are early on in the station, we ask this question because the patient is coming in with a very specific demand. Patient is asking for a minor contraceptive pill. So it's important that we are, you assess her knowledge about other methods of contraception and whether or not she would like to know about them. Okay, so we'll tell her there are other methods of contraception as well, which are more long term. We'd like to know about them as well. Okay, now depending upon the patient answer, if she wants to know, then we will discuss with her in the management part. If she doesn't want to know and she only wants the combined oral contraceptive pills, then a good question to ask will be, so what made you think that combined oral contraceptive pill are going to be the best option for you? Okay, so you might want to know the reasons of why she has been selecting oral contraceptive pill. Is it because she has heard it from some friend, or she has searched it, or you want to know her reason for her choice as well. Okay. After this, we'll ask her the questions to rule out basically contraindications for combined oral contraceptive pills. So basically, the history of presenting illness in the cases of contraception, in particular regular contraception, will be asking about um, any contraindication that might be present in the patient's case. Okay, so We'll tell her that I need to ask you a few questions to see whether the pills are suitable for you, if that's okay with you. Okay, and then you will start with any previous contraceptive methods. So, what methods of contraception was she using previously, and what were the problems that she experienced with it, and why she wants to change it now? Okay. Then we will ask the contraindication question. So we'll ask her, do you smoke? Do you suffer from migraine headache? Okay, if she's suffering from any not migraine headache, but she says that yeah, I sometimes have headaches, gives you a vague answer. So you need to accurately establish where they are migraine or not. So the follow-up question will be uh, has the headache ever been so bad that you had visual problem with it, or can you feel the headache coming? Okay, so do you smoke? Do you suffer from migraine headaches? Any sort of problem with your liver? Okay. Any blood clots in your legs or chest? Any family history of abnormal blood clots? Any family history of strokes or breast cancer? Okay. Now, basically, let me show you the list of absolute contraindications. There are a lot of contraindications for CCP. Some of them are relative, some of them are absolute. I want you to remember the absolute contraindication because you cannot miss them in the exam. If you miss an absolute contraindication, asking about an absolute contraindication, then this will be a blunder on your part, and you will definitely, you are definitely going to lose marks for that. This is basically the list of absolute contraindications for combined oral contraceptive pills. The first one obviously is pregnancy. Okay, you cannot prescribe COCPs to someone who's already pregnant. Okay, postpartum you cannot prescribe for up to 6 weeks, right? So up until 6 weeks after the birth of a baby, you cannot prescribe COCPs to the mother. Okay, then if the patient's age is more than 35 and she's a smoker, okay, forget about the number of cigarettes and everything. Just remember age more than 25 and heavy smoker. All right. Hypertension. So basically stage 2 hypertension. But in the exam, they will be very clear with you. They're not going to give you some big numbers of high blood pressure. So whenever in the exam, the patient tells you that I have a history of high blood pressure, or when you are doing the examination part and you check the blood pressure and the blood pressure is high, just avoid prescribing oral contraceptives. Okay. So hypertension, then diabetes with complications, okay, nephropathy, retinopathy, neuropathy, etc. Then everybody knows about this one, DVT or pulmonary embolism, okay, history of DVT or pulmonary embolism, and any recent major surgery with prolonged embolization, cardiovascular diseases, stroke, okay, migraine, which is basically severe headache with focal neurological symptoms. This is basically migraine headache. And then breast cancer, and then any liver problem like viral hepatitis, malignant liver tumor cirrhosis, so basically liver problems. So these are the questions that we are going to ask this patient. We basically simplified it for you to remember. Okay. Already asked about smoking. If she smokes, then you will ask, since when have you been smoking? How many cigarettes per day? If she says, no, I don't smoke, then you need to ask, have you ever smoked? Because even if the patient has smoked, less than 1 year, and it was heavy smoking and the age is more than 35, you still need to be cautious. Okay. So, and do you suffer from migraine headache, any sort of problem with your liver, any blood clots in your legs or chest, any family history of normal blood clots, any family history of strokes or breast cancer? And then any previous pregnancy. So basically the 4 Ps. I've written it here, it's 4 Ps. They're also, these questions are also ruling out your contraindications, and they are the 4 Ps of the gynae history. So the 4 Ps in any gynae history are basically period, pregnancy, pills, and pap smear. Which you ask, like these 4 questions you need to ask in every obs gynae history, which is pregnancy, pills, period, and pap smear. As this station is about pills itself, so this is going to be 3 Ps in this station. So basically pregnancy. So any previous pregnancies, when was your last menstrual period, and any chance you were pregnant at the moment. Okay, so this is also leading on to a contraindication of pregnancy and being less than 6 weeks postpartum. Okay, because with these questions you will know about that information as well. And then we'll ask about when was your last pap smear and what was the result. This question is again really important because combined oral contraceptive pills slightly increase the chance of cervical cancer. So you need to know about this one as well. Then we will ask about medications. So we will ask about medication allergies and medicines, which is basically the MEM is the pneumonia for medication allergies and medicine. So, medical conditions. So it asks the patient if she has been previously diagnosed with any medical conditions at all, like high blood pressure, diabetes mellitus, cardiovascular diseases, anything like that. And is she on any medications at all? This question is important because UCPs can interact with certain medications. We also need to ask if she buys any herbal medication or over-the-counter medication because certain herbal medications can also interact with UCP. Okay, so this question is important. And then, of course, asking for allergies is important. We are not going to ask about the full methodology here because obviously we will ask about family history and during while we are asking for contraindications. So that is not needed again. And then you can ask about psychosocial and lifestyle if you have time. Okay, so stuff like what do you do for a living and questions like that. And then ideas, concerns, and expectations. So we have already asked about her ideas about other methods of contraception in the beginning and why she thinks that combined oral contraceptives suits her the best. So we've already done that. If you forget doing it in the beginning, then you can ask it here. And then any concerns that she might be having about the oral contraceptive pills. Okay, so maybe she's worried about certain side effects or whatever she's worried about. We'll ask about that. And expectations, you already know that she's expecting you to prescribe her CCPs. Okay, then examination. So in examination, two things are important. You will verbalize blood pressure. So we'll tell her that I'm going to check your blood pressure and your weight against height because these two things are going to tell you whether you are going to prescribe CCPs or not. So if she has a very high blood pressure or her BMI is high, then again CCPs are contraindicated. Okay. All right. So once you've done all your data gathering and examination, everything is all right. There are absolutely no contraindication, and the patient BMI is in the normal range, and her blood pressure is okay. Then you are going to tell the patient that okay, everything is all right with you, and we are definitely going to prescribe you the pill. But I'm going to explain it to you because there's a lot to explain about how to take the pill and what to do if you mess a pill. So there's a lot to explain and a lot to listen, but I will still give you leaflets and links which you can study when you go home. And if you forget, then you can revisit the leaflets. Okay. So remember we already asked her about her last menstrual period, the date of her last menstrual period. So we'll tell her that the best and the easiest way is to start taking the pill on the first day of your next period. Okay, so for example, if she is on day 14 of her menstrual cycle, if her last menstrual period was like 2 weeks ago, and she says that no, doctor, I don't want to wait till my next period, then we'll tell her that okay, you can start taking the pill from today, but you need to practice barrier method of contraception for the next 7 days because they will not be effective like right away. So she needs to use the barrier methods for the next 7 days while taking the pill. Okay, and she can stop using the barrier methods of her day. All right, but the best and the easiest method for her is to start taking the pill on the first day of the next period, okay? Because when she start taking the pill on the first day of her next period, it will work straight away as a contraceptive, and she doesn't need to use any condoms, etc. All right. And we need to tell her that she needs to take a pill every day for the next 3 weeks following the arrow signs on the peg. So this is basically let me show you peg of oral contraceptive pills. This is basically the peak of the oral contraceptive pills. See, there are 21 tablets. So I'll tell her that you need to start taking the first tablet on the day 1 of your period, and you need to take the pills every day for the next 3 weeks, okay? But you need to take the pill for them to be the most effective. You need to take them at the same time every single day, okay? So start with a convenient time, maybe in the evening, after the evening meal or after the evening tea, okay? And she can put reminder on her phone so that she remembers taking it every day at the same time. Okay, so tell her that you need to follow this arrow sign. Start with the first pill and then follow this arrow sign and take the pills for the next 3 weeks every single day on the same time. Okay, and then give a break for 7 days. Right. So during the 7 days, withdrawal bleeding will occur. So you'll tell her that you will bleed for after when you stop taking the pill, and after a day or two, you will start having the bleed. Okay, and then you need to give a break for 7 days. Okay, before starting the next pack. All right. But do not take a gap more than 7 days before starting the next pack, because then it might not work and might not be effective as a contraceptive pill. Okay, now we need to tell the patient about missed tablets as well, or missed pills as well. Okay. So, for example, she forgets to take a pill. Um, she forget to take one pill, and that's okay. She can take the pill as soon as she remember, but she doesn't need to panic. She doesn't need to do anything else, and then she can proceed taking her pills as usual. Okay, but what if she misses two pills? If she misses two pills, then this is going to be a problem. Okay, so if she missed two pills, then she needs to use condoms for the next 7 days. Okay, because then she's not protected by the contraceptive effect of these pills. So she needs to use the barrier method of contraception for the next 7 days. Now there's another thing. If she missed the pills in the last 7 days. Okay, so in the last week of the pack, if she missed two pills, then what she's going to do, she will start the next pack without giving the 7 days break. Okay. So you will tell her, if you miss two pills in the last 2 days, then you are going to start the next pack immediately. Okay, you don't need to give the 7 days break as usual. Okay. What if she miss two pills in the first 7 days, in the first week? What if she missed two pills here? Um, so if she missed two pills here, then we'll tell her that you need to give us a call, because you might need emergency contraception. So if she missed two pills in the first week, then you'll tell her that you need to call the GP, because we might need to give you emergency contraceptive pills. And if she missed two pills in the last week, then she needs to start the next pack right away without giving a 7 day break. Right? And if she missed two pills somewhere in between, then she doesn't need to do anything else, just use barrier method of contraception for the next 7 days. All right. So this was basically about missed pills. Okay, then we need to tell her, educate the patient about the side effect of the pills as well. Okay, so there are some temporary side effect with the pills, and these are basically the normal hormonal side effects. So we'll tell her that you might experience a little bit of, you can feel a little bit moody, and there might be some irregular spotting or breast tenderness, but these side effects are temporary, and they will disappear after some time. Okay, so as long as she can tolerate them, there is no need to worry about, and they will disappear with continuous use. Right. Then there's another side effect which patients are commonly worried about, which is weight gain. So we need to tell her that a lot of people worry about weight gain as a consequence of taking pills, but the pills in itself uh, absolutely doesn't cause any weight gain. The only contraceptive method that is associated with weight gains are basically the injections. Okay, so the pills do not cause any weight gain. Um, Sometimes what the pills can do is they can make you feel a little bit more hungry. But as long as you are aware of your diet and are taking care of that, there's no need to worry about weight gain. Okay, then there are some serious side effects of the pill as well, but they are rare. Okay, but you still need to tell the patient. So you tell the patient that be aware of headaches, any severe headaches affecting your vision. Then you need to directly go to the emergency department, call 999 or go to the emergency department if you are having severe headaches, blurring of vision, or weakness in any part of the body, or swelling of your leg with pain, swelling of your legs, or any breathlessness. Okay, so basically you are safety netting, you're educating about the side effects of DVT, stroke, migraines, um, and you need to tell her that there is a slight increase in the risk of cervical cancer um, and breast cancer. Okay, but the risk is very low, like 3 out of 10,000, right? So these are basically the risks. So you need to educate the patient about that as well and safety net. And you will also tell the patient that this was a lot to listen to, and so that's why I will give you leaflets to further read. Okay, and as we have already established that this patient is safe, and as long as the blood pressure is okay, BMI is okay, and there are no contraindications, we're going to prescribe the COCPs for this patient. What we will do, we'll prescribe COCPs, we'll give her prescription for the next 3 months, and we'll tell the patient to keep an eye for these serious side effects. And if any of these side effects happen, then go to the emergency department. Okay, and if there is anything bothering her, then she can give us a call. We will we will arrange a follow-up after 3 months. Okay, so at 3 months after she has used the pills for 3 months and she's happy with it, and there are no side effects, she's not experiencing any side effects, she's happy with it, then and we are going to check her blood pressure and BMI again after 3 months. And if everything is going smoothly, then we will, prescribe those CPs for long term. Okay. And if everything is going wrong, if her blood pressure is increased or BMI is increased during this time, or she has developed any contraindication, then we're not going to proceed with that. Okay. One other thing that I missed is, can the patient take more than one pack, like back to back, without giving 7 days break? Because a good thing about COCPs is people can use them to regulate their menstrual period. Okay, so for example, 1 week they are going on holiday, so they say that I don't want to get my period for that week. So what they can do is they can take, they can simply omit the 7 days break and take the pills back to back. All right. But once people take more than 3 packs back to back, then what happens is they start having irregular bleeding. Despite taking the pill, they're still having the bleed. Okay, so that might not be very effective, taking more than 3 packets back to back. So you need to tell the patient that yes, you can take pills back to back. There is absolutely no problem with it if you want to, skip period. But once you start taking more than 3 packs back to back, then you will still experience irregular bleeding and spotting despite taking the pills. So you need to, after, a good idea will be to give a gap of 7 days after taking 3 packs and not take more than 3 packs back to back. Okay. So that was all about combined oral contraceptive pills, which is indeed the most common practiced method of contraception and the most important one as well with regards to regular contraception. And I will see you soon with the next video about contraception, which will be most probably emergency contraception.